Military families have been feeling the effects of long and repeated deployments for 9 years. Dr. John Lesica, a psychiatrist with the Cumberland County Mental Health Center, provides some insight into how deployments affect children and their families.
You know, being a resident and a provider here in Fayetteville, I've had the privilege of taking care of scores of children from military families as well as their parents. And during the process, during the last several years, obviously our soldiers have been deployed. And recognizing we only get to see those children that seek help, we have seen some children do very well with deployment where there's no apparent difficulty. But it's not uncommon for us to see children having anxiety issues, worry issues, and often our older adolescents sometimes show behavioral issues where they might have conflicts with teachers, with peers, and sometimes with society. So you really can't put a black and white response to the question of how does deployment affect our children, but I think our children do have an effect, and unfortunately it's not always a positive. In our clinic it can manifest in several ways. In the last several weeks I've had 4- and 5-year-olds whose dads or moms were deployed in the first or second year of life. And we're discovering some of those children are quite aggressive. Some of those children are having some hoarding behavior where they're like hiding food under their bed at 5 and 6, and there's really no reason. So sometimes some children have a difficult time with the attachment if it occurs early in that attachment phase of a year to 5 years. In our 6 to 10-year age group, some of those children are beginning to recognize daddy's not here. And they're old enough sometimes to hear that there was an accident or there was a bomb in Iraq. And it's not uncommon sometimes for those children to come to our office and have trouble sleeping, or they want to sleep in mommy's bed or daddy's bed, or they don't want to go out and play, they want to stay with mom and dad. With our older children, that 11, 12, even 14, 15, sometimes their difficulties become more pronounced in that they may have behavioral issues. A mother might come back and say, Johnny's acting out. Johnny's talking back and he never talked back. And although everyone will say, well, gee, it's normal adolescence, the truth is for some of these kids, you discover later on that, gee, I'm really worried about dad, or gee, when mom and dad get back together, it's really stressful and dad's coming home in 2 weeks and I don't want to deal with it. And rarely, we've had some older adolescents, 15, 16, 17, which have actually, these young people have actually crossed the line where their behavior either got involved with alcohol or drugs, and sometimes criminal behavior. And the tragedy is for these children, if you actually sit and talk to them, most of them have sadness, frustration, disillusionment. I think the most troubling aspect I have is that our children are home for such a short time that having mom or dad disappear for one deployment is a significant absence in a family's life. And I don't think we really truly appreciate or comprehend what the impact of having dad deployed, 3, 4 times in a 6-year period, and sometimes it's 5, 6 times in the last decade. As a father of 2 who have now left the home, I can tell you that if there's one piece of advice I'd give any parent is to cherish every moment with every child. And I guess I truly appreciate the sacrifice that our children, parents, and active duty members have made because there have been periods of their children's lives. But I think, we have so little time to get to know our children and for the children to get to know us that I think that I have concerns that they just, if nothing else, lose that joy. If you say, well, gee, Dr. Lesica, what do you think in terms of when do we seek? I think there are a couple things that our community may not realize. Several of our schools do have liaison from the military that have been put into the school systems. And they're supposed to identify those children who have active duty parents. And those liaisons frequently are the first to have, it's my understanding that they'll have often monthly or weekly meetings and they'll keep a tab of how the child is doing. But if I were a mother or father of a child and I saw a change in their behavior, whether it be a change in their academic performance, if there's a change in their sleep pattern, if there's a change in their mood, if there's a change in their behavior, if they generally are outgoing and now they're isolating, or if they used to stay at home and now they're never coming back, any significant change in behavior. I wish we could tell you that there was a magic red flag that they would wave, and the truth is each child is unique, and these children really are very sensitive to dad or mom's absence and also their presence. And the presence can be positive, but it also can be dysfunctional. So if you say, well, what do you see? I think the irritability behavior are really the worry signs. The struggle as a physician, though, is that if a child has mood swings, if you open the newspaper or turn on the TV, someone wants to label them bipolar or some other mood disorder, and it's a real dilemma. Is the child truly bipolar, or does a child have attachment issues due to losses that cause them to look bipolar? And I think if there was one thing I've learned in our military community is to be more thoughtful and hopefully less free in making the diagnosis of a bipolar disorder, because they can have mood swings and really have just had significant losses. And I think if we can get that child into therapy and provide the child support and provide the child with a stable structure, then often that child may not look quote unquote bipolar, and hopefully will help that child and family resume function. You know, I think the most important thing our parents need to realize is listen to your child. If it doesn't feel right, that's a signal to at least one, talk to your pediatrician or family practice. And if it really doesn't feel right, it's a great time to go seek help.